My name is Dr. Ravindra Mehta, and I am the founder director of Vayu Chest and Sleep Services, and also the chief of pulmonary and sleep medicine across Apollo hospitals in Bangalore. We at Vayu Chest and Sleep Services aim to give comprehensive treatment on an outpatient basis for respiratory and sleep disorders. And on that basis, today we're discussing a very important topic: sleep and its relationship with cancer, or some sort of intertwining between the two. Now, let's step back and understand this a little better. Sleep is intuitive, one of the most important parts of our existence. Literally, one third of our entire life is sleep, and indirectly or directly, it impacts on anything we do, whatever we suffer from. And herein comes diseases, and the king of diseases is cancer. On the other hand, cancer is a mystery which has still not been cracked by modern science, and we still need to know what is the relationship of cancer with so many things we do, and one of them is sleep. So, if we focused on cancer and food and air and pollution, why not look at sleep also? So, let's understand the role of sleep better in relationship to cancer. Sleep, ladies and gentlemen, is restorative. At night, everything calms down, and apart from the mental component, it is a process of healing, it is a process of repairing, it is a process of recovering, and ultimately getting the body ready to go through the remaining two-thirds of the day for functioning. In such a situation, at the cellular level, it is important for immune function, it's important for cell breakdown and cell healing, and a lot of these functions are those which are actually described as entities which are important in cancer. So it's uncanny how the relationship cannot be avoided. And so, if sleep disruption or sleep quality issues lead to immune problems, some sort of issues with cell breakdown or cell dysregulation, as we call it in medicine, we have a risk of possible cancer coming in. Is this definitive? Well, there are bits and pieces, and there is enough of a whiff in worldwide science to tell us that this is relevant, and that's what we'll talk about. So, does sleep affect cancer if it is too less or too much? This was something debated for years together, and we still don't know the answer, so we're not going to make categorical statements. But on the other hand, there has been a large literature reported study recently showing that people who slept less than 6 hours per day had close to a 40% chance more of having cancer. True or no, something we don't know for a fact, but there is definitely a signal in literature. People have also tried to look at oversleep. If you sleep more than 9 hours, then that can also be a problem. But again, there is no categorical evidence. So, suffice it is to say that if we sleep less, then between the immune responses which are deranged, between the mutations, that means the change of cells which happens, if there is something which goes awry, then there is a slightly higher chance of getting cancer. So, this is one aspect of sleep we concretely understand. There's another aspect of sleep, something called circadian disorders. In short, if you are asleep not in sync with the light dark cycle, that means you're awake at night too much, you're doing too much of night shift disorders, and you are just off from the world cycle and your cycle. Again, the whole problem of mutations, that the fact is that the circadian rhythm, that means that daylight rhythm, is related to cell recovery and cell healing, and there's a possible that disrupting it too often, too long, persistently may lead to a problem. So, something to be concerned about. But now let's say shift gears. What if I have cancer? What happens to my sleep? Turns out cancer itself disrupts sleep in around half of the people. Sleep, lung cancer directly causing cough, cancer chemotherapy, disturbances in the gut, disturbances in body ache, stress, anxiety, depression, all of these are known to happen in cancer patients, which can impact the sleep quality of these patients. What about thinking broader? Even people who have cancer caregivers have sleep disruption because of anxiety and depression. And even after cancer gets cured, it has been shown that in adolescents and adults, bad memories, trauma, and sleep disruption is known. So, all in all, there is an intricate relationship between sleep and cancer and sleep, and we all need to make sure that we have a healthy life. Sleep is an important part of it. And God help, if we get cancer, we should seek both moral, psychological, medical help to try and make sure that we can walk that path easily and give ourselves enough rest and sleep and mental peace so we can fight cancer adequately. Thank you.